Hello, I'm Dr. Jonathan Silverberg. I'm a professor of dermatology and director of clinical research and patch testing at the George Washington University School of Medicine and Health Sciences in Washington, D.C. There are a lot of challenges, even for some of the best dermatologists out there, assessing the heterogeneity of atopic dermatitis and the severity of atopic dermatitis across diverse patient populations. And it's important to recognize a few key factors. First, as what are the problems or what are the challenges, and then we can discuss some potential solutions. So first challenge, I think that's the most obvious, is with increasing phototypes, with darker skin phototypes, it gets more and more challenging to assess erythema. The erythema can be masked by the pigment, and so it's just harder to appreciate, but often the erythema just doesn't look the same. Instead of shades of light pink or dull red or bright red that we often will see in the lightest phototypes, we'll see shades of purple or just shades of brown. And that in of itself is a challenge because sometimes you see dark shades of brown on the lesions and you're not even sure if it's inflammatory hyperpigmentation or post-inflammatory hyperpigmentation. So it's really important to train your eyes to be able to recognize the diverse color palette of erythema across diverse patient populations. So that's one problem. And one solution that we have offered is we've recently published a skin atlas on how to assess the eczema area and severity index across diverse phototypes, really giving some examples to anchor your assessments around the different phototypes. So that's one issue. The other issue to recognize is there are morphologic variants that come up across diverse patient populations. We see more follicular eczema in patients of African descent, whether that's Afro-Caribbean, African-American, or studies done in Africa proper. Now, when you're looking at a patient with a lighter phototype, first of all, we don't usually see that morphology quite as often. But when you're looking at a patient with darker phototypes that has this morphology, you have to be very careful not to just mistake that for dry skin or for keratosis pilaris, which is arguably a manifestation of dry skin. I have seen patients who are erythrodermic with follicular eczema be told that they're clear and they just have dry skin. So it's very important to recognize those types of morphologic variants. Other morphologic variants that will show up more commonly in specific patient populations, perhaps patients of African descent or Southeast Asian descent, would be nummular eczema, prurigo nodules, more profound lichenification. So you have to be on the lookout for these morphologies and recognize that these are particular concerns and know how to really gauge how to assess the edema papulation, how to assess the lichenification and differentiate that across diverse patient populations. And this is something that for the dermatologist, we're visual learners. So that means you need to look at atlases with diverse photos. You need to really work with Kodachromes that you can really train your eye on and stay fluid with. If you're not seeing as diverse of a patient population. Now, if you are seeing a diverse patient population, it becomes very easy to retain those skills, but you still have to do that initial work of making sure that you can differentiate severity of the different signs across diverse patient populations.